Well, we're here today, though, is to let you know that now the Guard is in need. We have an emergency of our own, and we're here today to request help in the entire state. The emergency we're facing is an increase in suicides in our force. Since January 1st of this year, we've had 4 suicides in the National Guard. 2 of those are confirmed by a coroner. 2 are reported as suicides by the police and are pending a coroner's confirmation. But in addition to those 4, we've also had 5 other deaths that are reported as unattended deaths. Okay? And they're no longer being investigated. But it still gives us reason to be concerned. That's too many. Out of respect for the families, we do not intend to talk about the circumstances of any of these deaths or to provide their names. The families have suffered enough, although that suffering is far from over. And our thoughts and prayers are with families. Our hope today is that by reaching out, we can get the support we need from the communities of Arkansas, that we can prevent any other loss. And we can prevent any other families having to suffer like this. When I say we, I'm not talking about just the National Guard. I'm talking about family members. I'm talking about employers and entire communities. They see these soldiers and airmen on a daily basis. As a traditional reserve force, typically we only see our guardsmen 1 weekend a month. And we've emphasized throughout our chain of command to encourage our soldiers and airmen to keep an eye on their battle buddy or their wingman and to be alert for those risk indicators. Although we made major effort to identify those that were stressed or needed help, we realized we can't do this on our own. We've got to have help from the families and employers. The communities are on the front line with our soldiers and airmen every day, and that's why we're asking to help us get the word out to them. Now, there's no empirical data to prove exactly what causes someone to resort to suicide. There are a number of indicators: relationship issues, legal problems, financial issues, occupational issues, deployment, operations issues. Frequently, those are compounded that when they're suffering from those kind of challenges, there's an increase in alcohol and drug use. So with all that together, it makes an unpleasant situation for them. I don't think there's any question that deployments play a major role in increasing stress on our force. But of the 4 confirmed suicides that we've got right now, only 2 of those had deployed. 2 had not. But operational stress among all of our soldiers that have redeployed is a common denominator for those that we've identified that need help and we've gotten help for. Suicide knows no boundaries for us. It has hit both officers in enlisted ranks, both Army and Air Guard, and those that have deployed and those that have not deployed. And this is not just a Guard issue. In 2008, the Army-wide suicide rate, when compared to the national average, was higher than the national average for the first time in the history of the military. As a result, they formed a training seminar, suicide stand-down, to train and educate soldiers throughout the entire Army. And we joined the Army in that effort. Okay? That places our suicide and awareness training as a higher priority than any other training that we've got. And we joined the active Army in implementing that in February. To date, over 95% of our troops have been through the training. They completed the first 2 phases of training. That training focuses on improving the soldiers' understanding of those risk indicators and what they can do to help intervene. And through our family support programs, that training is also available for them. Along with these efforts, we frequently publish command information materials to increase the level of awareness. And we've also hired 2 new positions, Director of Psychological Health and our Suicide Awareness and Prevention Manager in the state, just this past year, to help us with this. We in no way insinuate that those in uniform are at risk of suicide. The percentage of suicides we've had is a very small percentage of our total force of 10,000 soldiers and airmen. However, we've got to recognize the fact that we do have a challenge here. And we've also realized we can't do this on our own. We've got to have help. And that's why we're reaching out to families, we're reaching out to employers, and to communities to help us. These individuals are soldiers and airmen that are suffering, that need help. And the strange thing is, once they're identified, they're normally easy issues, easy to fix. But the problem with us is being able to identify them, because typically we don't see them the other 28 days of the month. That's why we're calling on the families. We ask that those individuals, those families, those employers, keep an eye on that soldier or airman that they may see. Be alert to any unusual or uncharacteristic behavior, and engage them and listen. In a lot of cases, it's just a matter of listening and having somebody to talk to. If nothing else, call us if you've got questions. At any time, we would ask that the communities, if they identify an individual in need, talk to them, get them to a professional, a chaplain, or an emergency room. By all means, give us a call. We can certainly help identify those resources that are available out there. Most importantly, we ask that you talk to those and ask those in need of help to reach out for it. We continuously advise our soldiers and airmen, if you need help, ask for it. We remind them that it takes the courage and strength of a warrior to ask for help. And a lot of times, that's our biggest challenge. It's not easy to admit that you can't handle a problem on your own. And our soldiers and airmen, just like most people in the community, they're proud and they're not used to asking for help. They're used to solving problems.